Then lastly, I want to reflect on vaccines. We've had some very important news. We see the AstraZeneca vaccine is making progress both in the UK, in the US and in Europe. I've been briefed this morning by the global head of AstraZeneca and the Australian head of AstraZeneca. Our vaccine program is on track and ahead of schedule. The Oxford AstraZeneca vaccine is progressing well, both in terms of results and in terms of its passage through the UK, US and European processes. I'll let them speak for themselves. They have submitted additional data within Australia, and we're expecting the final data for consideration in late January to early February. Pfizer should be complete during January. AstraZeneca will be late January to early February. And we have our confirmation of supplies from the global head only this morning, both international supplies and domestic production, which is being done here in Australia by CSL. Our Pfizer contract has been completed with the confirmation of distribution to Australia also locked in over the course of Christmas, with our Department of Health officials working literally right through Christmas Eve and Christmas Day. So I want to thank all of those who've been involved, to say to Australians who've been tested, you've done a magnificent job, but please keep coming forward to be tested. And for New Year's Eve, stay safe, stay out of the Sydney CBD. From the Premier could not be clearer, and as a Commonwealth government, we support and reaffirm that advice. But Australians have been magnificent this year, and they've been magnificent over Christmas, and the proof is literally in the pudding. The fact that Australians have been able to gather together safely, whilst those in other parts of the world have been all too sadly prevented, and in some cases we see hospital systems under immense and profound challenge in the most developed of all communities. That says that what we've been doing is working, we'll continue to do it, and we'll continue to keep Australians safe. Happy to take any questions, I think starting with Tamsin.
Thanks, Minister. I just have 3 questions, but they're all on the same topic, if you'll bear with me. The US has implemented a need for people coming from the UK to test negative before boarding a flight to the US. Is that something we're considering here? And given the highly contagious nature of this strain in the UK, are there any other measures that the hotel quarantine systems taking passengers from the UK at the moment should be implementing? And also just a data update, how many cases of this new strain have been confirmed in Australia now?
Sure. So firstly, in terms of the testing as opposed to the hotel quarantine, Australia has arguably the most rigorous entry limitations in the world. There are a couple of jurisdictions that match that, but 14-day quarantine is not widely used in the rest of the world. On the discussion with the Prime Minister only this morning, the Chief Medical Officer reaffirmed that although it is tough, although it is exacting, although many would find it difficult, and having been through quarantine twice myself, I understand how challenging it can be. His view, the Chief Medical Officer's view, is that Australia should not reduce that requirement in favour of a pre-testing arrangement, that the highest standard in the world is the 14-day hotel quarantine, and we won't be relinquishing that for anybody else. So that will remain our standard. The lesser standard of test and travel is not something that we think is sufficiently safe for the Australian context.
What do we do, though?
The best advice from the Chief Medical Officer only this morning is that the right approach for Australia is the approach of the hotel quarantine. They have concerns that a test does not in any way guarantee that somebody is not symptomatic when they fly or when they arrive in Australia. Only that 14 days provides the full guarantee that Australians require. But the medical expert panel will continue to review advice from around the world, and if they believe that other measures are necessary, they'll adopt them, but they won't be watering down that Australian approach. The additional questions, please.
Sorry, yes, just further on that, how many cases of the
Look, I'll refer that to the Department of Health and they'll provide a statement this afternoon. We haven't had the update on that this morning, so I'll let the Department of Health provide that in writing to you today. Then in terms of the strengthening of hotel quarantine, we have had 2 rounds of review. We've had firstly the Holton review, where Jane Holton has looked and made recommendations for all states and territories, overwhelmingly found it to be one of the strongest systems in the world. We thank Victoria for adopting the recommendations, and they have implemented a new system, a dramatically new system, which we believe is strong and effective and vastly stronger and more effective than it was previously. Other states and territories were already strong but have adopted the Holton reviews. At the same time, Alan Finkel, the chief scientist, has reviewed the testing and tracing systems, but that has implications for hotel quarantine, and again, all states and territories have adopted those measures. We also have a clinical evidence team, and they're reviewing advice and evidence from around the world. And so I think that's a very important thing for Australians to understand, that there's constant review feeding into the medical expert panel from communicable disease experts and the finest researchers in the country.